People will trickle in. Go ahead. Okay, well, hi everyone. Again, this is the CAR 101 webinar. We are the Awards Standing Committee. Just to orient you to who we are that is talking tonight. So this is the Awards Standing Committee, and my name is Grace Thompson. I'm the current chair, and then we'll go around and introduce ourselves. Kaylee, if you want to go first.
Hey everyone, my name is Kaylee Patillo. I go to the University of Missouri, Kansas City.
And then Sarah is at the University of Toledo. She's not here with us tonight. She unfortunately has a rotation responsibility. And then next will be Paige.
Hey guys, can you hear me okay? Sorry, my Wi-Fi is cutting out. My name is Paige. I'm a fourth year from the University of Florida College of Pharmacy, and I will be doing feedback calls from Regions 3 and Region 7.
And lastly is Mr. President-elect himself.
Thank you, Grace. And my name is Sean Kawa. I'm currently a third-year student at the University at Buffalo, currently serving as the APHA ASP National President-elect. And with that role, I also serve as a
Good job.
liaison to the awards standing committee.
And of course, we couldn't be doing this without our wonderful staff contacts. So we have Parth on the call tonight. Parth, if you want to introduce yourself real quick.
Yeah, I'd be happy to. Hi, everyone. My name is Parth Patel, and I serve as the Senior Manager of Student Membership and Chapter Development here at APHA, and also serve as the Staff Liaison to the Award Standing Committee. So I get to also read all your wonderful car reports, and I know how stressful this is. I got to write our car report, or help write our car when I was a student pharmacist, and I remember those long, long nights. So don't worry, we're here to support you during this time.
And then, of course, we also have Ronnie Levinson, who is newer to staff, but he's a senior manager of student and new practitioner experience, but not new to APHA ASP. Lots of experience with APHA ASP, so he's also a contact for other things. To get right into it for our agenda for today, so we're going to talk about what is the car timeline, the three I's, commonly misreported items, uploading and labeling media, chronological lists, who is responsible for the car, resources and tips, and then we're going to go into feedback calls and how you can schedule a session with us, and a Q&A at the end. So first up, Kaylee is going to take it away with what is the car?
All right, so I know some of you have participated in writing your chapter's cars previously, but some of you are very new to this, so we're just going to go through, first of all, what is the CAR? So CAR stands for Chapter Achievement Report. This is just your opportunity to show off everything that your chapter did this year, or this past year. I know you guys put in a lot of hard work, and we want you to be able to showcase everything that you guys have done. It's also a learning opportunity for you guys, for your members. It provides your chapter with the opportunity to be recognized at the awards celebration at APHA annual meeting and exposition. And finally, it is required for your chapter to maintain its charter. So why write the car? Again, we just want to showcase, we want you to have the opportunity to showcase everything that your chapter did and all the hard work that you put in this year. It also offers your chapter to assess how the year went, what do you guys want to do differently next year, determine improvements that you can make as a chapter, and then it allows you to qualify for awards at annual. So we're going to discuss a little bit of the timeline. So I would say the most important thing in the car timeline is start early. I know from watching chapters go through this and listening to chapters talk about this process, it takes longer than you think it does. So if you start early, this will be like a lot less burden on your members and the students that are helping write this. So March and April is the time for the car workshop, which you guys are here. Feedback calls, which we sent out emails about those. So if you didn't get those, please reach out to one of us. And then time to meet with your leadership team and your advisors so you guys can discuss your game plan for writing the car. And then this is an opportunity to delegate tasks at this time. And then come May, this is the time for you guys to write your car sections. I know some of the chapters write these as the year goes on, so some of you guys already have a start on this, but this is the time at which you guys would want to get going on writing the car sections if you haven't already started. Create your chronological list, which we'll talk about in a little bit. Collect and upload media, and then car feedback calls continuing at this time. And then come June, this is your time to kind of polish the report that you guys have written. Make sure that the advisors lay eyes on your report. And then the car is due on June 15th. So everyone drop in the chat, when is the car due? Put this on your calendars, put this on your chapter calendars, whatever you got to do to make sure that you guys make this deadline.
Okay,
All
we're
right, and
going to
I will
hop
pass it off
over
to
and look
Paige.
at the three I's. So kind of going into what that means. Next slide, please. So the first one is going to be the innovation, involvement, and impact, and we're going to deep dive into each of them right now. So next slide, please. First one, innovation, kind of looking at how are the activities that your chapter chose to spend their time and resources on creative and or unique for your chapter members and the community. And the back, that's a big one too. I think each of us have the privilege of being in a different part of the United States that the community has different needs. So how were the initiatives that your chapter took part of? How did that benefit the community that you live in? How is it different from what you've done before? So if you kind of have hosted an event that's a continuation of a previous like initiative, state what you did to add to that event, what you did to grow, or how you guys like took feedback from the previous year and made the event better. So if like, and it's in a long-standing event you've done for the past 8 years, hey, members said that they found more benefit when doing like a blood pressure screening to like train the members first. We had implemented a training. Tell us that and tell us how you guys took an event that you've done for multiple years and grown and built it and to make it better. If it's a new event, like I said, tell us why and why you identified this event as something of importance that your chapter would spend its time on and how does it stand out. And we understand that each chapter has different sizes and there's different funds and resources that go into the events you host. So what makes it special to you guys in the community? And let us see that side of your chapter versus like us looking at objective numbers. Involvement. So how are your members, faculty, community partners, how are they involved with the implementation of these activities? Focusing on like the planning process, where preceptors involved, where advisors involved, promotion of international meetings if your chapters do take on the IPSF sector, promotion of the strategies to help the members and the public, member training, overall level of collaboration. So in general, you want to help us quantify like if 30% of chapter members or 1/3 of the P1 class, etc. And like I had said before, we know like University of Florida College of Pharmacy, we have like 400 members, but one of the schools in Florida next to us, they have 72 in their class. Others have 40 in their class. And we know that 15 members in the 40-person class is huge. But like 70 members in UF's class, yes, is big too, but like they're on different scales. And we can recognize that when we read your essay. So we don't want you guys to feel like if your chapter doesn't receive like a lot of external funding or they are just a smaller chapter that you guys aren't eligible for these awards and recognitions because that's not the case at all. You just have to tell us that so the award or the future awards committee can kind of read through and make those decisions. Um, Also, be specific too. One of the biggest things reading the card this year, if you collaborate with other schools, other student organizations or programs, like write the full name and if necessary, if it's something that's not like very well known, just do like a sentence of context because sometimes we'd get acronyms and we couldn't figure out exactly what org we were collaborating with, so we didn't really know the true impact. Also for certain people, like if you have a policy initiative, kind of explain like who they were and the importance of collaborating with them. So for example, University of Florida had one of our senators come speak to us, and we wrote in our car like this is important because he's one of two pharmacists in the Florida House of Reps. So having his advocacy is important, and this is why. Or like we invited a guest speaker to like was who was the past national president, but we had to tell them that because maybe the award standing committee wouldn't have known. So just quantify the impact of who you're inviting, who you're working with, so the awards committee knows. Because as much as we try to stay involved and be aware of what other chapters are doing, we just there's a lot of chapters and we don't know everything. Next slide, please. Impact. How did the event affect the target audience and those involved? What were the outcomes? And discuss the activities that affected the chapter, community, and profession. First point can also like chapters can maximize your essay discussion on the impact by talking about barriers you overcame. So one of the chapter achievement reports we read this year was like their school completely cut off external funding. So they were solely on their own as a student organization. That has so many barriers that their leadership team didn't anticipate to have to deal with, and that really affected the type and the quantity of events they could put out. So they communicated that and said, despite all of this, we still had the chance to do 3 patient care outreach events, and we increased our fundraising from $200 last year to $400 this year and spent our materials on blood pressure cuffs. So telling us that impact and things that you did to overcome those obstacles that we don't see at face value. Impact, you guys know why is what you did important, what the outcome had in your community. So a lot of the schools like down in the South, they're like have a very large Hispanic speaking population. And so when they do point of care outreach events, if they have flyers to give out that are made bilingual, or they have interpreters, or they have members of their College of Pharmacy who get to speak and educate in both Spanish and English, showing us why that's important. So taking that into account so the award standing committee can really see that. Also to kind of share with us if it's growing. So like, oh, we had a 10% increase from last year, or we had 20 more volunteers than we've ever had before, just so we can really gauge like what your chapter is doing and how you're growing and get to celebrate you guys the most appropriately.
Awesome. So next we're going to talk about commonly misreported items. So first off, in general reporting, we saw a lot of like discrepancies between internal events and external events. So we just wanted to define here like what an internal event is, like when you're doing your chronological list. So an internal event is any event where you have the target audience as the chapter members or students in the College of Pharmacy, whereas an external event is any event involving a partnership with an organization outside of your school or College of Pharmacy. So an external event would be something like a health fair that kind of targets more like undergrad students at your university, whereas an internal event is something that's more so within like a chapter level. And then next, something we wanted to emphasize was chapter-specific patient care projects. So this is anything that's not one of the 6 nationally recognized projects. So if your chapter per se has maybe like a chapter-specific Operation Infectious Disease or Operation Pride, something like that, that would be a chapter-specific patient care project that not every chapter across the nation could have. That's when we want you to really highlight those instead of talking about the 6 nationally recognized projects that have distinct sections within the CAR for recognitions throughout there. And if anyone has any questions about, hey, I don't really know if this is chapter specific, if it's not within the 6 nationally recognized projects, then it's definitely chapter specific, and we want to see you highlight it there. And then next in the policy section, just the distinction between legislative advocacy and public advocacy. So legislative advocacy is anything relative to advancing the profession. So like letter writing campaigns, voter registration drives, anything directly related to legislation, whereas public advocacy is more so advocating for the public, educating the public, I mean, on the profession and kind of giving more information on pharmacist scope of practice and what pharmacists do, even if that looks like going out to a health fair and talking on the pharmacist scope, pharmacist practice, that kind of thing. That's more so public advocacy, whereas legislative advocacy falls more within like a Capitol Hill Day, that kind of thing. So any questions about that, we can also field. And then lastly is the IPSF section. So we want to see any activities related to IPSF public health campaigns. They made this really a helpful document last year on the different IPSF campaigns and where different operations fit within those. So you can see here how it has infectious disease, but it's APHA ASP Operation Immunization within that. So if you do an Operation Immunization event, you can count that as an infectious disease event on the IPSF side. So it's a very good way to be able to incorporate other events you do that you might not necessarily think is IPSF, but they really are because they're falling underneath these campaigns. But when you're doing your IPSF section, definitely focus in on those events that are specific to your IPSF, your international VP. I think we really like to see those events that are unique to the international VP. And that really helps kind of bolster up your IPSF section. But we definitely love to see the different ways that you're able to incorporate Operation Heart and Operation Reproductive Health into IPSF as well. And then I have the QR code there that should take you to that document. And then lastly, just general reporting things, kind of technical things that are just nice to see in the report. Trying to stay with student pharmacists instead of pharmacy students, always doing APHA ASP and not like a sole APHA or sole ASP. And then kind of moving away from the old terminology of women's health into Operation Reproductive Health. Same for Operation Substance Use Disorder. It's no longer Generation RX or abuse disorder. It's just Operation Substance Use Disorder. And then if you ever have any acronyms or organizations that have little abbreviations for them, just try and spell those out for us because we may not know what that is. All right. And I'll pass it off to Kaylee.
Okay, so now we're going to talk about uploading and labeling your media. So first of all, to talk about photos, really this is an exciting time for your chapter to be able to get on the big screen at APHA Annual. We use these photos through like slideshows as people are walking into like the student kickoff and award ceremonies and such. So this is really exciting for your chapter. So we want to make sure that you guys are uploading these with your car. So in terms of like limits for photos, we want no more than 20 digital photos per car section form. So that would be a maximum of 150 photos that you can submit. So you can send a lot of these in. Photos, we want to make sure that they're labeled correctly. So we have the format here. It's going to be CAR 2025 and then your chapter name and the project. And then once photos are submitted to APHA, of course, APHA now has the right to use these photos. So if you don't want these photos used anywhere, please don't be submitting them. All right, next slide. So you can also, let's see, the photographs and supplemental materials should be submitted with the SharePoint link. So you guys will get this invitation from staff the first week of May. If you have any issues, please feel free to reach out to one of us or the APHA ASP email that's listed here. And then in terms of videos, you can submit up to 5 videos per car form section. Don't include your FarmFlix video. Of course, we already have access to that, so we don't need you to include that. But here you can see it's pretty much the same format, your CAR 2025 chapter name, and then the project. And now we'll get into chronological list. So I know this can be a little bit confusing. I want you guys to know that on the pharmacist.com website, we have here how to access all the CAR materials. So that will be a very good resource to you guys. But of course, if you have any questions, feel free to reach out. But this is what the template looks like for the chronological list. A lot of you guys already have this. You guys use this every year. But make sure you're using this format and you're not submitting like an Excel sheet or like a Word document. We want it on a PDF form, and then you'll submit that with your materials. And each event needs to have all these questions answered. So recurring events, you don't need separate entries for recurring events. You can use one entry. So like for example, your executive team meetings, you really only need one entry for that, but just make sure that you add all of the dates. And then to be considered for awards, you have to submit a chronological list. So to be eligible for the National Chapter Achievement Award, you have to submit a complete chronological list. And then to be considered for the National Patient Care Awards, you have to submit individual patient care chronological event lists. So like for example, you'll have a chronological list that will go through every event that you did the entire year, and then you'll have chronological lists for each of the sections. So for example, you'll have an Operation Diabetes chronological list, an Operation Heart chronological list. And then every event described in the car must be reported in your chronological list. Otherwise, us as the award standing committee, we can't really take that into account because we didn't have proper documentation of that event. So we want you guys to get credit for the work that you did. So just make sure it all goes in the chronological list. All right, and now I'll pass it off to Sean.
Okay, thank you, Kaylee. So I'm going to do a quick pulse of the room again. So can you guys tell me either on mute or throw it in the chat who is responsible for completing the chapter achievement report? Okay, got a couple answers in there, and they are partially correct. There we go. Everybody is responsible on your leadership team for completing your chapter achievement report. Next slide, please. And car report writing is absolutely a team sport. Now, on the next slide, we're going to talk about some good strategies for how you can go about doing that. So first and foremost, if you don't know where to start, you're lucky because you have a wealth of individuals and insight that you can tap into, whether it be the award standing committee here, past leaders from your chapter advisor, new practitioner mentors if you have one at your chapter. So you have plenty of resources to reach out to if you're looking for a place to start and really hit the ground running with your car reporting. But as I said before, completing the car is absolutely a team sport. And for a multitude of different reasons. First and foremost, to give yourself some grace if you're a chapter president. If you've been involved in the process of writing a car in the past, you know it can be a bit of a beast to complete. And so delegating the responsibility of completing the car amongst your leadership team just ensures that it can be completed in an efficient manner while also not allowing select members of your leadership team to be burned out. But it's also effective for allowing each individual who is responsible for planning events throughout the year to accurately speak on behalf of those events that they help to create. So if you're one individual completing the report on your own, you might have an idea about what happened throughout the year, but might not have all of the different nuances that individual members of your team had when hosting those events throughout the year. And so by bringing those individuals in, you're also sharing that workload and allowing each of those people to really speak on their efforts throughout the year. And so good examples of that would be allowing your different patient care project chairs to speak on their programming, things of that nature, just allowing your car to be as robust, as accurate as it can possibly be. And with that, I'll pass it back to Grace.
Awesome. So now we're going to talk a little bit about the logistics of submitting your report and then also what resources they will have available to you. So on pharmacist.com, there is a Chapter Achievement Awards Program section. And so you can either search APHA ASP Chapter Achievement Report, and this will come up. Or when you go on the website, you can go to the chapter, you can go to awards and go to Chapter Achievement Awards Program. So here you'll find all the different requirements, the guidelines, appendices, additional resources, and the submission form. So here you can go where we said, where the chapter achievement report on the APHA ASP website. And when you submit your report, you'll basically create an account and you'll want to do a generic login so that either you or your advisor can log into this because your advisor will have to be the one that signs off in it at the end. I would advise that you kind of save all your responses in a separate document and have one person submitting all that, like pulling that stuff over from that document onto the form because you can only have one person on the form at one time. So again, as I said, make sure you're saving all those responses in a separate document and saving all uploaded documents as a PDF. The chronological list needs to be uploaded as a PDF. Anything like your budget, that also needs to be uploaded as a PDF. And then again, only one person can be logged into the account, the form at one time. So you really don't want anything to get lost if someone else is logged in at the same time as you, because that would be the worst thing ever if you get all this work done, someone comes in and it is all lost. We really do not want that to happen because at that point, there's not much we can do, sadly. So that's what my chapter did is we had everything on a Word document in our shared Google Drive, filled out everything on there, and then when it was done, I went over and copied everything over onto the CAR form, had a generic login so that my advisor could log in at the end and sign off on it. And then here are the guidelines and appendices. It does say 2024 to 2025, but nothing has changed. So that is completely up to date, and y'all are good to go and good to use that. The 2024-2025 car reporting guidelines apply to this upcoming year. Just gives you an overview and then a kind of description of the divisions, the different awards, and kind of how we select awards as well. And then it does give you the instructions on how to submit again. And then the guideline appendices are really where you're going to look for anything chronological lists, anything, any details you really want to know. So the chronological list template that Kaylee talked about is in there and kind of details how you can use it for recurring meetings or individual meetings. A glossary of terms and kind of those abbreviations and things. And then when Kaylee was talking about uploading media, when it says project abbreviation in these appendices, it has exactly what abbreviation you need to put as. So for example, Operation Diabetes, I believe it's just OD. It has all the different abbreviations for you in the appendices. And then it has essay guidelines to kind of help you look at those essays and kind of figure out how best to write them. And then in there is a car sample form as well. We will have an updated car sample form out to you guys, hopefully by the end of this month, early April, because we did change a couple things on the car. So I would advise you can go ahead and start looking at the car sample form, but I would hate for you to do more work than you have to do, because spoiler alert, we did change not a huge amount, but we did take away some things. So again, I would hate for you guys to do more work than you have to do. And then there's the list of divisions if you're ever curious about what division you're in, and then determining membership numbers. So lots of helpful resources to kind of point you in the right direction. And then last year, the award standing committee made this document, Help, I'm Riding a Car, and I don't know where to go, where to start. And so it kind of details the three I's, quick tips, and kind of like who your audience is, and then also questions to ask about each car section. So again, this is a really great resource for y'all to use just when you're writing your car, as this was written by people who graded cars, who wrote cars, have been in your shoes, and kind of went on to do more with the chapter achievement report. So there's another QR code that'll take you to the website where that is located. And then lastly, for resources, just again, maximizing your IPSF report. On the pharmacist.com, there is an IPSF section that has this IPSF public health campaigns document that you can reference that will help you kind of outline under which operations different IPSF campaigns are under. So again, just maximizing your IPSF report because there's plenty of things that you wouldn't think are IPSF that really are. So we really wanted to emphasize that for y'all. All right, and now I'll pass it to Paige for some tips.
Awesome. Next slide, please. So just some kind of tips, biggest things about not sure what goes in what section. So like Grace was mentioning, if you open the blank reporting form in the additional resources section on the CAR website, you can kind of find the checklist that you're going to fill out when you officially submit the CAR. Also too, when you like enter the submission, I'm pretty sure you hit save, but like you don't have to do it all in one time. Other chapters prefer to like copy the questions and sections over and do it on a document. And I think that I would suggest that just to have it for your chapter's records. But that's like how like my chapter, I know like Kaylee and Grace's chapter, they do that too. They copy it on a separate slide, have it vetted by like advisors and their team that's in charge of submitting, and then kind of go onto the form for real. But looking at the big things, the biggest things we've noticed this year and kind of moving forward is when you have to select what, for example, professionalism events are conducted by your chapter, we want to include like all of them. But that being said, if you check food drive, clothing drive, interprofessional event on that chronological list for professionalism, you need to have like the food drive, clothing drive, and interprofessional event. And so say that food drive was for Operation Diabetes, technically but it still is a food drive. You can have that event on both lists. You just need it on both lists. So that was one of the hardest things, like for us grading, because chapters would put that they had all these initiatives, and reading their MasterCard list, like yes, we would see that, but we couldn't like refamiliarize ourselves with it. It's hard for the awards committee to go back and find that specific event that you guys are referencing within that professionalism section. Like it doesn't, the submission doesn't need to be changed. Just copy it over and make sure whatever you're marking down, like that event is correctly represented in that chronological list. And if it's part of the essays, it's part of stuff that your chapter wants to highlight, make sure it's pointed out there. And Grace had said too, like you can double dip, like that's, we're just trying to encourage, and we'll take into account that too, but like we want to encourage like the correct reporting or consistent reporting, I guess, throughout all the sections. And I know some of the sections like professionalism and IPSF get confusing. So in your chapter feedback call or throughout the card writing process, like we're still available to talk and we can kind of walk you through like what's the best or the most appropriate way to approach. Big thing too, I want to point out is policy legislative advocacy versus public advocacy. Those were two very misreported or confused terms. Legislative advocacy is kind of like your legislative days. It's meeting with representatives, it's meeting with delegates. If you're doing stuff on behalf of your state pharmacy association, talking to people who are going to make those changes and who can advocate for our profession as a whole. Public advocacy is more so kind of going out maybe at a farmer's market and talking about pharmacists' role within the community and what pharmacists can bring to public health or healthcare in general. So that's kind of the separation between the two. I know it's a little confusing and I was confused on it too, but also examples of each are going to be listed in the activities completed section so you can kind of get a better gauge. And like I said, we can also answer those questions too, because I know that's something that I struggled to report like my first year or so writing the car. And that chapter step came to me and said, I don't really get it, which makes complete sense. So you're not alone, but we are here to speak about it. Next slide, please. Kind of overall, going big picture, we want to hear your story. More doesn't equal better. If there's paragraphs and paragraphs and paragraphs of fluff, you run the chance of like the true work or the true impact of your events and initiatives being diluted out by us filtering through all the fluff. Because it's important to communicate like why the event's important, but 5 sentences leading up to the big importance of this event, I feel like sometimes the true impact gets lost sometimes. Don't be stressed by the word count too. Like there's no max, there's no minimum. If you can get what you have to say in 6 sentences and it shows exactly what you want to show up, like put out about your chapter, that works for us. Biggest things, tell us about your wins, the challenges and barriers. Also too, remembering the audience. Remember, we're looking at the innovation, the involvement, and the impact. Also, I want to kind of point out, we had talked about this a lot on the awards committee last year, like chapters, it's so awesome to see them do long-standing events. So biggest things we noticed with chapters would have the wrong years in the chronological list. They would have the same exact date, which on the calendar it wouldn't make sense because if it's like a week health fair, but it's on a Saturday this year randomly based off the date, like it's just like copy and pasting like the template of your events, I feel like is perfectly fine. But assuming the dates changed, assuming the number of participants you had, a number of advisors present, and what the synopsis of like the impact of the event, that changes a little bit year to year. So we do expect that those submissions do vary in that sense. And I think that gets a little harder too in the operational section where you kind of explain your guys' election processes, this and that. And like UF, like we have the same election process. We really don't make the changes, but the number of people there, the number of advisors present, those things change too. So we do notice when submissions are like verbatim copy pasted from one year to another. And that's not saying like things aren't going to be the same, but there are little nuances that should be changed on each submission, no matter if it's continuation of a previous initiative. And if anyone has any questions, I'd be happy to kind of talk more about that because I know that's a little bit of a gray area. Anyone have any questions? I'll kind of stop there for a second. So I know that was kind of a lot. No? Okay, we can go to the next slide. More tips from us too. Statistics when applicable. I'm not good at math, but I was for when I wrote it a few years ago. So we grew by 42%. We had 30 more volunteers than we've ever had before. 1/3 of our P1 class was in attendance. Those are big milestones that you guys should be proud of, that you guys hit for your chapter. And so share those with us. And really help us quantify because I think I did my best to familiarize myself with each chapter, but I don't know exactly how many students are in Kaylee's College of Pharmacy. Same with Grace's. I just know it's smaller than UF's, but I don't know the numbers. So like 72 is like huge for like University of South Carolina, who has a class of like 120. But for classes who have like 500 students, like it's just a little different. So we just need to know, and the award standing committee does their best to be aware, but just helping us out a little bit will really make things a lot easier so we can really analyze your chapter. And I want to talk about AI a little bit. I think the next slide talks more about it. This is APHA and APHA ASP's official statement on the use of AI. So, like I said, as in the statement, we support it, we encourage it, but the careful use. You can tell, I feel like nowadays, if things are written from I think it's good for grammar checks and I think it's good to get the base foundation, but I think it does you guys a disservice to know that you put in a year's work of effort and passion into these events that you're going to let the robot with AI write your chapter achievement report when you should want to share yourself and your chapter should want to share itself in its own words why what you did was so monumental. So kind of taking that into consideration, but you know, you can use it to kind of get the framework, kind of make the adjustments as you see most appropriate, but we just want to encourage the appropriate use of AI for writing the chapter achievement report. And then if Parth has anything to say about that, I don't know. I feel like no.
Awesome. Thank you. I just want to harp on this. Like, our tip is like really remember your audience. The award standing committee is made up of student pharmacists that have likely written the CAR, helped author the CAR, so they are very familiar with it. They would not be on the award standing committee if they were not familiar with it in some capacity. So they know what goes into it. They know all the hard work that goes into it. Um, but just remember that we do have the last year's report. We do kind of know what AI usage looks like. So it's very important, again, like just put your best foot forward, because you really can highlight everything that goes on in your chapter. And it's really huge, like reading these. We read hundreds of reports, thousands of pages. We each read them twice, so we get all the good things that y'all do. We love reading them, and it makes them a lot more enjoyable when we get to read things that are written from your heart, things that you're really passionate about. So please do like put that effort in for these. We really did enjoy reading them this past year. So I'm really excited for the incoming award standing committee to read y'all's this upcoming year. But now we'll go into feedback calls. So yeah, y'all should have gotten an email from your region's representative this past week on feedback calls. So if you're president or president-elect, you should have gotten an email. If you did not get an email, it's probably because your chapter roster isn't updated. And we hopefully would like you to update your chapter roster. And if you did not get an email, please let us know. But again, you should have got an email. This is just a great way to learn kind of like what was great on your chapter achievement report, what kind of needs improvement, kind of like delve more into resources and kind of have a safe space to ask any questions you have if maybe you don't want to ask questions now and you just want to ask them one-on-one. And you can totally invite your president, president-elect, literally anyone that's going to be helping with your report. We do ask that you let us know. So we'll be sending out emails sooner to the feedback call signups. But please let us know at those emails, like who's coming, just so we know, like if your chapter advisor's coming, so we can kind of like prepare for that as well. But deadline to sign up will be April 3rd because these will be taking place in April. We just want to get a good gauge of what we have, and we don't want someone signing up the night before and us not realizing. So here is regions 1 and 8 and 4 and 5 if y'all need to sign up. Sarah will be running 1 and 8, and I'll be doing 4 and 5. And again, should have got an email. We'll also be sending out reminder emails, and they'll be sent out, I think, on the chapter updates as well. And if you're at annual, it'll be in the president and president-elect session web presentation. So these will be plastered everywhere. You will not forget. And then next is regions 2 and 6 and 3 and 7. 2 and 6 will be Kaylee, and 3 and 7 is Paige. These are just really, really great times. We really revamped how we do feedback calls. So this past year, they had like a nice formal feedback call template where we kind of run through the car, run through your specific car, and kind of like what we picked up on in our notes from this past year, and how you can improve and how you can continue doing the good things that you do on this past one. So it's really, again, can't say enough good things about it. It's just a really good time to get FaceTime with us and get our opinions as well. So now, kind of like we have 17 minutes until the official end of this. So if anyone has any questions, we are happy to answer any questions at all. You can unmute or drop in the chat. Yeah, you can go ahead. You don't have to raise your hand.
Oh, hi, sorry.
No,
Um,
you're okay.
my name is Min and I'm from the MCPHS Boston chapter, over in Boston. Why did I say Boston? Boston. And I have like just like a quick comment. So I this year I'm the president, so I've attended through my president-elect year, and I've also like witnessed like the car process of last year and also very gear up and ready for this year. So the way we do it is like the way that we sort of like do car for our chapter is because we have these templates from like years before of the chronological list and also like the car in like a Google Doc. Since our like training at the beginning of the year, we already like let the EBOR know that each person who because we have 15 people in our EBOR and 13 do events. So we let each of them keep their own chronological list on like our shared like OneDrive, and they all have to individually update their chronological list. And we also came up with our own sort of like internal checkpoint of making sure that like it's kept up because you know how the year go by really fast. So I think with how detailed like our sessions with like the Car 101 has been going, it's super helpful. And also with like the new changes that you mentioned, is it possible for like a consideration for the future if we could sort of like touch point this at the beginning of the year when we just sort of like kickstart this process of like running the year? I know we have a lot of things planned at the beginning of the year, so I think it would be like very helpful for chapters to sort of like have a heads up about what's gonna happen and to sort of put things in place because I think it'll be like very helpful. But that's just like something that pops up in my mind when we were going through this training. But thank you very much. It was very informative and I loved it. It's very helpful.
Yeah, of course. Thank you. No, that's a great point. I think chronological lists is something you can start very early in the year. I know my chapter did, a lot of chapters do. So that's a great idea and something we can pass along to the upcoming award standing committee to kind of get stuff started a little bit sooner and kind of maybe have like a webinar at the beginning of the year. That's a great idea. I like that. Thank you. Yeah, go ahead.
Um, Specifically, I know you were talking about when you have to write the specific like little check mark stuff of like did the interprofessional or something like that, professionalism, and then you were saying like it's kind of hard to backtrack into the chronological list to like refer to what events we're referring to in the checklist. Should we say in the chronological list like I did this event and I'm going to be putting or like this will be part of that checklist there? Or like, is there a way that you want us to denote in our chronological list what we're having this qualify for? Does that make sense?
Yeah. So with that being said, like I think what we ran into, like on the master chronological list, there would be like, I'm just making up a number, 80 events that the chapter did through all the operations. And then we would get to like say the professionalism essay, and it would be like food drive with I'm making up something, Fighting Hunger, this company. But then I would look at the professionalism's chronological list and it wouldn't be there. So it'd be hard to reference it. And then kind of going back to the main chronological list, like there's just so many events. So I feel like you don't need to like say like this is qualifying for this because we'll know. Because if you put that you did a food drive for Operation Diabetes that also qualified for IPSF that also qualified for professionalism. If you have that event in all three of them, we're gonna know what you're talking about. It's just like for easier access, not for like a we're missing it, just for like so we don't have to like kind of filter through like a 90-page doc that we can just do like a doc of like that operation or that part of the car specific event. Does that make sense?
Yeah, I think so.
Okay. If you have
Thanks.
questions too, you can just email me too, and then we can talk more about it just to make sure that you guys feel comfortable, kind of reporting the car and if going from there.
And to kind
Okay,
of
thanks.
answer your question, I think a little bit farther, there is a section on the chronological list where it says classification of event. And so on your chronological list, it will also be able you will be able to specify like the classification.
Got it. Thank you.
I had a quick question for internal and external events. If you were doing an event directed towards like undergrad students, like it's not technically the School of Pharmacy students, is that internal or external?
I personally would say it's more external because it's like the audience itself is like external to your College of Pharmacy. I don't know, Paige or Kaylee, if you have a different opinion, but I feel like that's what we went with was external was more so if it's outside of your College of Pharmacy, like the audience is directed outside, then that would be external.
Yeah, I would agree.
Yeah, like for example, if we had like a guest speaker come talk about breast cancer awareness that was geared towards College of Pharmacy students, it would be like an internal event that APHA ASP hosted. But if we went, I don't know, to like just what like a farmer's market to do outreach, that's like an external. And so my chapter in the past has done like panels for pre-health professions, and it was like external because they weren't like pharmacy students we were targeting.
Okay, thank you.
Mhm. Any other questions? Totally okay if you don't have questions right now. I know it is a little early in the process, and questions will arise as you get further into it. It's another huge part of these feedback calls is that you have that opportunity to ask questions. Also, our emails are on these slides that will be sent out or posted on the website. So if you have any questions at all, you can also find our emails right now on the website under National Leadership. And we will be happy to answer any questions you have at all. But yeah. As a parting, if everyone could put in the chat when the car is due, that would be amazing. June 15th. Sean, you really said July. I can't. Anyways, thank you guys so much for joining. And we hope to see y'all at feedback calls very soon. And at APHA annual sooner than that. Okay. Have a good night.